Heart failure is basically a symptom complex wherein a patient's ability to pump enough blood to the rest of the body is not there. So the heart is not able to provide adequate oxygen and energy in the different organs and tissues, and then patient develops symptoms. So this is called heart failure. So heart failure can be divided into two types. One is the low heart pumping function or low ejection fraction. And there's another type of heart failure which people are not much aware about, which is heart failure with normal heart pumping function. So it is your doctor's cardiologist job to find out what sort of heart failure you suffer from. Now, what are the symptoms of heart failure? What are the patients going to come to the doctor with? So patient will complain of breathlessness on exertion. So they will feel breathless. They will feel short of breath when they exert. So for example, if they walk certain distance, as I said earlier, maybe half a kilometer or 50 meters or whatever distance they are happy with, they will walk. And after that, they'll start feeling breathless. So they need to stop, take rest, get their breath back, and then they will start walking again. So this will happen again and again. So this is in the initial stages of heart failure. So when the heart failure progresses, patient may start complaining of breathlessness at rest. So even if he's sitting or not doing anything, he may feel breathless. Or they may feel breathless at night time. So when they're going to bed, they may go to bed for an hour or two, and after that they wake up feeling really breathless. And that is also a symptom of heart failure. Sometimes patients also complain of swelling of their feet. And this ankle swelling or swelling of feet could be as a result of water retention, which could be as a result of heart failure. Some patients also complain of abdominal fullness. The tummy gets full. Or they may also complain of pain in the right side of the tummy. Also may feel nauseous, not feeling like eating anything. And these are also symptoms of heart failure. Heart failure will go with the heart failure with low pumping function or low ejection fraction. The normal pumping function is 55% and 55 to 60%. So when we say heart failure, usually these patients have ejection fraction less than 50%. So some may have less than 30%, some have 30 to 40%, some have 40 to 50%. So we divide them into different categories of heart. The commonest cause of heart failure is ischemic heart disease. That means the blockages leading to damage to the heart muscle, and that eventually leads to reduced pumping function of the heart. And that is heart blockage related heart failure. So that is a commonest cause. That is the commonest cause of heart failure. Number two, the diseases called cardiomyopathy, which could be related to genes. That is a second important cause of heart failure. Third important cause I would call is high blood pressure, uncontrolled. If the BP is not controlled, then it can continue to damage the heart muscle, and that can lead to heart failure. Number four, there are diseases like diabetes, in which they have normal vessels, but they still can have reduced pumping function of the heart. So that is called diabetic cardiomyopathy. It's a condition in which heart muscle gets weakened in a diabetic patient, but there are no blockages. So that's another form of heart failure. Then another cause I would mention is virus. So many times you have heard this virus called corona or herpes virus, and these viruses can cause heart failure. They will cause permanent damage to the heart muscle, and then the heart is not able to pump in an effective amount of blood. So viruses induced cardiomyopathy. Other things like toxins. So I mentioned alcohol earlier. So if person is consuming too much amount of alcohol, more than 40 units in a week, then they are very likely to develop alcohol-induced cardiomyopathy. So excessive drinking will cause damage to the heart muscle and lead to alcohol-induced cardiomyopathy. We will take a good clinical history and come to a diagnosis of heart failure based on their symptoms. We'll do clinical examination, check their heart rate, blood pressure, do their assessments, clinical assessments, and then we will come to a conclusion that they may be suffering from heart failure. Then the next level of test we will do is ECG and then 2D echo and color Doppler. ECG will give us some indications about underlying diseases, and then coronary color Doppler and 2D echo is going to tell us how much is the heart pumping function is, whether the patient has 30%, 40%, or 50% ejection fraction, whether that has caused any problems like valve problems, leaky valves, the valves that cause the heart failure, whether there are any clots inside the heart chambers, and so on and so forth. So all this information is given to us by 2D echo color Doppler examination. And this is the very important test for diagnosis of heart failure. So once the diagnosis of heart failure is done, then we need to investigate why did the patient develop heart failure. So as I mentioned, there are so many causes of heart failure. So we have to also know why did this particular individual has developed heart failure. So we do investigations to find out this why. And one of the important reasons, important cause in such circumstances is to do coronary angiography to exclude blockages. So once the coronary angiography is done, we will know whether there is a blockage problem or there is no blockage. And that defines which sort of treatment this patient is going to go under. Because heart failure, as I said, is a very huge topic, and we need to define the cause. And coronary angiography forms one of the most important diagnoses after 2D echo to find out why this particular person has developed heart failure. The most important treatment for heart failure is medication. Okay, so there is not much in terms of surgical interventions, I would say, but cornerstone of therapy remains lifestyle modification, and there are different medicines for heart failure. So these medicines are very standard. Worldwide is a protocol for giving all these medication, and there are 5 different medications all the heart failure patients would be on. So it's a very standardized treatment. The doses and the company names may vary a bit, but the medication will remain the same. So once we have controlled the heart failure, we will move on to diagnosis. As I said, why did heart failure happen? We may recommend this patient open heart surgery, bypass operation to treat the blockage problem, and then heart failure may improve. Somebody may have a valve problem, leaky valve or blockage of the valve, choke up valve. So in such circumstances, we may recommend the valve surgery, the problem may improve. So the underlying cause may be treated with surgery, but not per se the heart failure. Heart failure, there are many other things which we can do for heart failure, like implantation of special pacemaker or implantation of a device called defibrillator, or if it's a terminal heart failure, patient may need artificial heart support system or left ventricular assist device, which is basically artificial heart. Or in extreme situation, patient may need a heart transplantation. So it's a huge topic, and for general population, I would say that leave it in the hands of your experts. Don't put yourself too much into this diagnostic dilemma. You need to follow your cardiologist, and the cardiologist has this defined way of dealing with this problem. So they will advise you as per your needs and the stages of heart failure you are in.